We're now going to turn to our first panel of the day with a conversation about the growth of the food as medicine movement. And joining me for this conversation, we have Tamara Melton, the co-founder and executive director of Dietetics. Then we'll have Raye Stevenson, the founder and CEO of Women Advancing Nutrition, Dietetics, and Agriculture, also called WANDA. Dr. Kimberly Jackson, who is the director of food studies at Spelman College, and Karuna Rawal, who is the Chief Revenue Officer and Chief Marketing Officer for Nature's Fynd, and our good friend Jennings, who is the Stakeholder Relations and Brand Lead for Health and Sustainability at Ahold Delhaize, USA. So please join me in giving them a round of applause. Thank you. Welcome, everyone. So nice to see. This is a big panel, and we have a lot to talk about, so I'm so excited to turn to each of you. Tamara, I always like to start with you, because you've taught me so much over the years, especially during the pandemic. And so I'm hoping that you can talk a little bit about nutrition and the nutrition and dietetic space today, the lack of diversity that still exists, and what that means for the care that is available to the people who actually need it.
Yeah, so I'd like to share the data just to let people know where we're sitting at. So I'm a registered dietitian, as is my colleague here next to me, a couple other people who are going to be speaking, and there's about 100,000 registered dietitians in the country. About less than 15% are people of color. It doesn't matter what group they identify from. So when we think about that, and we think about the reflection of what the country looks like, we don't have people who are, what I always tell people about dietitians is that our magical powers that we have, or something that we have, is that we can look at a food and break it down into its scientific properties. But then if we don't have people who are coming from that culture, who can also tie that in, then we have a huge blind spot. And so that's something that we have seen as with the work that we do at Diversify Dietetics, is really looking at that. We like to say we work in workforce development, because even us as a profession and other people who are professionals who are working in food and nutrition, if we don't have more people who can take both that science part of it, looking at the health part of it, but then that really important part, which is culture, because that's the thing that people have that tie them back to their home every single day, that they can do several times a day, then we know that there's that big blind spot there that has to be addressed.
And those blind spots are deadly if we don't address them. And I wonder, I'm sure that young women, students come up to you all the time wanting to be involved in this work. What advice do you give them?
I tell them to know that they are experts of the food in their community first, and don't, I think those of us who have, and a lot of us in this room have lots of letters after our names. We work really hard for those. But people from their communities and know those communities, and to tell them to start from there and feel really proud about that.
Yeah.
And then as they start to layer on their formal expertise and their training, to never forget that, because they are bringing in something that's missing right now into our profession, into other professions. And so to always keep that, not to second guess themselves if they know that they're the expert, as they start to layer on the evidence-based practice.
Thank you so much for that. And Tambra, if I can turn to you, you've also, like Tamara, been lifting up this idea of different diets. You and I have talked a lot about this idea of like the Mediterranean diet gets, lifted up as the only diet that's going to make you healthier if you want to lose weight or lower your cholesterol. There are so many diets, especially in African cultures, that could do better maybe than the Mediterranean diet, or just as good. Can you talk about how to include those African cultures and other cultures in these food as medicine discussions?
Most definitely. Such a privilege to be a part of this dynamic panel to raise an important conversation about our food is our medicine. And when I say that, I speak to the fact that I grew up in Oklahoma with a Ghanaian stepfather. I learned very early on about this dynamic of living in a dual household of American South and also African cuisine. And because of that, it had my curiosity wanting to go find the foods to help heal my grandmothers who have diabetes, one still living at age 97, geriatric pediatric nurse retired from OU Medical. Check out the piece that I did for Eating Well magazine on our African heritage diet as medicine. That's up for a James Byrd Award consideration this year. But I go on this journey of finding my own heritage through the Fulanis and going to Nigeria and being able to understand that we need more investment in African nutrition research here in the US because of the emphasis and really this concept of the West being better than the rest of us. Having been having dinners from Kenyans to Nigerians to Ghanaians to South Africans on the continent, we are playing such a huge vital role in influencing even the nutrition content on the culture in the continent. And that really speaks to the volume of the work that we have to do here. And so part of that is the investment in NIH nutrition research, but also the curriculum that is taught in our schools must change and reflect the dynamic transformation of our demographic. But also it speaks to when we don't have a seat at the table for all the cultures, that means that we're truly not a part of a food democracy, and that everyone should say that their food is a part of the culture of America. Also, it speaks to local food economy. If we're not making sure that all foods are part of it, that means some folks are not able to make money because they're not showing that we're not investing in the functional foods of African cuisine that we know are climate smart, from fonio to millet to bitter leaf, plantain, black-eyed peas, like all these different wonderful dishes that make our culture dynamic and our health better, and everyone can enjoy these cuisines as well. So I invite you to come to DC, where we have such a large African diaspora community, to be a part of it, but it shouldn't just be locked into one area. I think with the rise of high on the hog, Black food is just growing in this space, and as a communications PhD candidate in America, and part of my goal and role is showing how media should transform how we share the narratives, and why we launched a Black food census through Wanda, that you can go to that article at Eating Well and complete, because we need more data around consumer insights to really share that there's a market demand for these foods, and the need to research them and make them more available through the supply chain, and how from farmers growing the food to the nutritionists being able to educate people, especially as precision nutrition is taking off, and understanding that we have to personalize our nutrition, and that means our cultural foods like millet and all the rest are part of that need to be a part of the conversation and have the nutrition analysis around it.
And they build resilience in so many different ways, not just to climate change, which takes up all the oxygen in the room, but it builds resilience in communities. And that capital and investment is so needed. And I want to come back to that, as well as the storytelling piece in a minute. Kimberly, if I can turn to you, when we last spoke, you mentioned this term that I had really never heard before, but that you are personally working to cultivate a generation of compassionate scholars who are aware of the effects of systemic racism on these issues, on our diets, on culture. And I'm wondering what that looks like at Spelman, and how those compassionate scholars are being cultivated and grown.
Yes, thank you.
Do you want to trade quickly as someone will get you a new mic? Thank you.
Hello.
We'll fix this. Thank you. There you go.
Thank you. So at Spelman College, I'm a scientist by training. So when Danny and Bernie asked me to be on this panel, I started saying, do I do food as medicine? But I do. Part of my scholarship is in plant-based therapies for advanced prostate cancer. Wow. And so as a part of that, I'm in the chemistry department. I'm head of the chemistry department. About 40% of our scholars at Spelman are in STEM, and they want to go into the health field. If they see me, their junior year and their senior year, they may see me in biochemistry course. I don't teach biochemistry the traditional way. We train our students to think about compassion, to think about empathy, to have cultural sensitivity, because they're going to be moving into that medical space where there are people that may use botanical medicine. And so how does that look? So we take the stigma and the attitudes away from using botanical medicines and to pair it with what we consider pharmaceutical medicine today. And so that's what we do, what we mean by training these compassionate scholars. And we've taken it a step further at Spelman. We have this beautiful garden that you heard our provost mention, where we grow over 100 different crops from the African diaspora. We have this wonderful garden educator and specialist who pours love and cultivate that space. And because of that, we, for the first time, launched our Black herbalism course this semester, and so students are able to take it a step further. They work with the herbs in the classroom space, and they're actually growing what they work with in the classroom. So yeah, compassionate scholar is a big deal for us in terms of creating this type of cultural sensitivity for our students today.
And that's been missing in this field for so long. And what I love about what you're doing at Spelman is that you're celebrating food, you're celebrating, the idea of these plant-based options as medicine, as they truly are, and culture, and also justice. And I wonder what you're learning personally, Kimberly, from the students themselves.
It's amazing. I'm learning everything. I'm learning that life is food. Food is medicine. Food sustains us. Food heals us. Food is in our everyday walk. What is wonderful about our students, we take them on a global trip around Black foodways every year. And so we take these students who are econ majors, they are theater majors, they're computer scientists, they're health sciences, because it's an interdisciplinary program. And they go to these spaces and they're able to unpack how food impacts the world. To have these types of global and political discussions are absolutely amazing. And it's taking this Black woman who is a scientist to a new level of really digging into the food world, where at one time I just said, oh yeah, I work with a natural product from licorice root, and by the way, it has this, beta-diketone constituent called dibenzomethane, and students look at me like, what? And by the way, it treats prostate cancer, and they're like, hey, Dr. Jackson, you're curing cancer with food. And I was like, yeah, that's what I'm doing. So I learn every day from our students, and it's been an absolute pleasure.
It's fantastic. What a great environment to work in, and your students, and you are very lucky. Karuna, I want to switch gears a little bit and talk about the private sector and how you think food brands are thinking about producing options for eaters that aren't only better for them, in the food as medicine way, but are also products that they want to buy, that are delicious, that they want to consume, because none of this works, right? We can all talk about food all day long. If it's not delicious, no one's going to eat it, and it's not going to help anyone.
Absolutely. First of all, just so honored to be here with this esteemed panel. So I appreciate being here to have an opportunity to talk about how really it's going to take all of us, right? Like food is something that is so permeated, with our culture, our communities, and it's really about, bringing joy, ultimately, Danny, as you said. And I think one of the challenges as we think about trying to change behavior in food, and I come from a background of marketing, consumer behavior and consumer insights. And our company is trying to really do something to change how we all eat. And that is not a small task. People have some very deep emotional connections to food. And one of the most important that sometimes we forget is joy, to your point. Food brings us together and it gives us a great deal of joy. So as we think about behavioral change, I think it's incredibly important that we create delicious options so people don't feel like they have to sacrifice in order to either be healthier or do something that's better for the planet. So the company I represent here is Nature's Fynd, which is a new to the world protein we're introducing to the world. It's a fungi protein, so it's not a plant or an animal. It's actually the third kingdom, which many of you studied in science, right? And based on a discovery that was actually made in Yellowstone National Park. So our chief science officer, who is a graduate student, at that time at Montana State, was doing some research for NASA, and that research to understand how life can thrive in very resource-constrained environments led them to Yellowstone National Park, and that's where they discovered this fungi. So we have a new protein, it's called Phi. The F is for Fusarium, which is the strain of fungi that it is, and the Y is for Yellowstone. So if you hear Phi protein, that's what we do. And hopefully you'll have a chance to taste it. Our yogurts are in the back, but we are now creating meatless and dairy-free foods that are made from fungi. And the remarkable thing about fungi, if you go back to my story in Yellowstone, is they are excellent at thriving in very harsh conditions. This particular one really has been thriving in if you can imagine, the volcanic hot springs of Yellowstone. Not exactly a hospitable environment, but learning to do more with less, which is, as you think about humanity, humanity and the point that we are at with our planet and our resources, we really need to figure out how to do more with less. So we're very excited that we're bringing something new into the ecosystem for food. But the most important thing, and the thing that everyone in my company will tell you I run around talking about all the time, is taste, taste, taste. It has to be delicious, because you can be, curious and try something that's innovative once, but if it doesn't taste delicious, you're not going to come back. So we've put a real premium on introducing foods that are delicious. Fungi have been around forever. We just haven't thought about them. I mean, we eat, the distant cousin of the fungi, of our fungi, which is the mushroom, obviously. But there's lots of fungi that can really help us solve some of these challenges. And they use a fraction of the resources to grow. And most importantly for this discussion, as we come back to kind of this idea of food as medicine, food has to bring joy, but food is also medicine, right? It can help us heal. And fungi in particular, this one that we're working with, is 50% protein, a good source of fiber, and protein and fiber together are super important as you think about nutritional density. So for every calorie you're consuming, you want to get as much of both of those things.
Yeah.
And it's hard, we look at animals that provide a lot of protein, plants may provide some protein and fiber, but we've got this unique combination in fungi that we are really excited about. So just thinking about, food bringing joy, it has to do that in order for us to be able to take advantage of it. So we're excited to be able to bring another option, and it's going to take a lot of solutions. People get into the conversation about, is it plant-based, is it fungi-based, we need all of it, right? Because, each of us kind of has this opportunity 3 to 5 times a day to choose how we eat, right? And making one of those choices, whether you do it once a day, once a week, but to make a better choice that's better for your health and better for the planet is really what we're trying to do. So that's kind of the challenge we have ahead of us.
Thank you. Those products that combine joy and health and innovation and science are all really interesting. And Stephen, that makes me want to turn to you. And as a retailer, I'm wondering if you can talk about is it easy to make shoppers find these kinds of products and help them make healthier choices? And what are sort of the obstacles you're facing as a retailer, who I know is someone who cares deeply about this issue and cares about hunger and access and affordability, but how do you steer those consumers towards healthier choices?
Oh, $1 million question. So I'm the only one not worthy to be on stage with these great leaders here, so I appreciate the invite. So I work for a large grocery retail group, actually the largest on the East Coast. We stretch from Maine to Georgia, over to Tennessee, and we serve 30 million customers a week. So the impact that we have on customers' purchases, it's pretty significant, right? So one of the things we're challenged with, it's like the simple question that Danny just asked, but it's all the zillion challenges that happen behind the scenes, which is 65% of us still make our purchases in a brick and mortar grocery store, right? So we have the education, we know we shouldn't eat this or that, and we should eat more of this and all that, but at the end of the day, you hear all that, you go into the grocery store, you may be by yourself, or you may have 3 screaming kids hanging on the side of your shopping cart. You then have a choice to make between A and B. And A, I know my kids are going to eat it. B, I know it might cost a little more and it might be a little healthier for them, but I don't know if they're going to eat it. What do you think they're picking? Yeah. So the challenge for us is, and one of these is one of our commitments with the White House, the End Hunger Challenge, is up to $1 million in education and awareness specifically for diverse communities and socioeconomic challenged areas. So what we found, and we have a ton of dietitians, and they work all throughout our brands and help bring in that awareness, education, culturally relevant, but it comes down to, is it what I want there, and can I afford it?
Yeah.
So what we have to do is showcase, what all does affordability mean? It's not just the price tag, because that's the first thing we associate, but it's the value in the product. So again, if there's a question that my kid or I may not eat it, then am I going to waste the money if I'm on a fixed income or government assistance? So this is where we have to kind of show them the way and showcase, whether it's through recipes. And we have tons of online services in all of our brands when it comes to some of this work. But at the end of the day, we have to show value. So does anyone here eat eggs by chance? Are they a little expensive right now? Or have been, for sure. So we have to show value beyond the eggs. We have to show additional protein options and other things like that because we have all of that. We have on average 70,000 items in our grocery store. 70,000 different items. So it's part of our job as the role model to nudge, we like to use the word nudge all the time, nudge our customers to better for you options. And one of the ways we do that in store is through a shelf tag program we call Guiding Stars. So Guiding Stars is a way that you can shop for better or more nutritious products in a store. We also have public commitments related to healthier purchases within our store. So we're committed internally to nudge, again, our customers, because at the end of the day, we're all Americans here, and the one thing we hate is to be told what to do or told what to buy. So we need to show them and nudge them without telling them. And that's the thing that we work really hard every day to do.
Yeah, and that makes me want to come back to the storytelling point that's been brought up. How can we create, this is really a question for you all, how can we create a better narrative around what healthy food is, what food is medicine, so that people feel included, that it is an inclusive system? Tamara, maybe you can address that first.
I think people know a lot about food already, and they know what to eat and what's healthy, so just letting them know that they have that information first. If you ask somebody, what should you eat? Most of you know fruits and vegetables and probably should move my body and drink water.
Right.
So starting from that perspective and then building upon there, because nobody likes to go in thinking like, I'm doing everything wrong. I don't know what I
Right.
should be eating. I'm not feeding my children the way that they should. I'm stunting their growth or something like that.
Sure.
So I think starting from there, letting people know that they do have baseline knowledge. They know that. Maybe we need to tweak it. Maybe I'm borrow nudging. Maybe we need to nudge them to something more. But like starting from that perspective is a positive note, and then working from there.
Right, Tambra.
Yeah, I would say to jump in,
Sorry.
that's one of the key reasons. As a mom, I created Little Wanda as a character, our version of Smokey Bear for nutrition. And through her journey,
She's real cute.
Yeah, we have books here for those who come. But Little Wanda is about going on this foodie journey to Africa, meeting with Big Wanda, farmers, nutritionists, those in the culinary space, and using African foods as medicine, and making them available in the local African language, Kiswahili to Hausa to Amharic, and making sure that we bridge this cultural gap by way of showing not only these characters like Mama Do Millet and Hassa Hibiscus, but also sharing the fun and joy, as our colleagues shared on the panel, that what food can do and bring in creating belonging in the community, in the kitchen with family. And so having everyone from Nana Wanda, Mama Wanda, Auntie Wanda, and Little Wanda, we show through these multi-generational narratives that we are all a part of being the food heroes who are wearing capes as aprons. And it's so important to help uplift and share that. We have a patented design of Little Wanda. We want to really scale what her narratives can be in a changing demographic in this country, but also the influence it has on the continent as well. And so the Wanda Academy became a hybrid learning platform supported by Johns Hopkins, where we've created an opportunity for Mama Wandas and Auntie and Nana to come together in real life to learn about cultural foods as medicine with a nutritionist who's from that culture, and also be able to link it up with the therapist because of the mood-food root connection, and then also ecotherapy, getting them out to farms, planting their feet in the ground, reclaiming the soil again, and knowing where the food comes from. So it takes a multi-generational approach to center them as the food hero of the story, borrowing from Joseph Campbell's work, and really understand that when you have women who are the face of food insecurity in this country, then they bring along the community, and why we're launching Food as Medicine, the Black Community Initiative, with the help of many of our partners this year as well.
Thank you so much, Tambra. Karuna.
Yeah, just to build on quickly, because I know we're tight on time. I think one of the most important things we can do is connect with community in order to drive change. So one of the really interesting things for us has been, as we launched our brand, and we have this protein that's incredibly versatile. So one of the benefits we have is it's a protein platform where it can allow us to create a lot of different foods. So different ethnic foods, different regional foods, different cultural connections that allows us to create, a huge variety, because we can't just take the same food to every community and expect that they're going to adopt it or change their behavior. The other thing we've just seen just in our data is the consumer that we're seeing coming forward and being really excited about what we're doing are actually Black and brown women. And they're one of the most underrepresented voices in this whole food movement. So one of the things we've really decided to double down on is really working with influencers in that community and finding creators in that community to help share the message, because you're going to listen to someone, frankly, who understands where you come from, who has a similar background, similar context, and can relate, right, and can translate the message. So it's not just one message that works for everybody. So I think it's really thinking about what is the messaging we're trying to deliver, and really communicating that this is something that's better for you and better for the planet.
Absolutely.
So we're trying to take the conversation from why would you try something that's this new innovative protein to why wouldn't you? If it's better for you, if it's better for the health of our planet, and it's most importantly, it tastes delicious, so you're not feeling like you're making a sacrifice and you can buy it at an affordable price. That's really, I think, kind of bringing all of those different decisions together in order to create change.
Yeah, Dr. Jackson, I know storytelling and narrative changing is an important part of the work that you do. Can you talk a little bit more about that?
Yes, so we do work around digital archiving and oral history. We have partners now with Princeton University where we're going out into the local area, and we're going to South Georgia and Alabama, and we're collecting the stories and preserving the history of Black and brown folks. And so this is a way that we can also continue with food traditions and understanding food traditions, and this is what we're doing also at Spelman College. So
Thank you.
I just want to end by saying, because we're at time, food equals joy, and you've heard that a lot on this panel today. Good food is good food, and it does bring you joy. My husband and I do have an IG. I'm not good with social media, but we're the cooking chemists. And so if you at me, that's what a young person told me, at me, the cooking chemist. We don't post much, but on occasions, you'll see joy and happiness around the table of cooking, two chemists cooking good food together.
I love it. I love it. I'm going to take one more minute to Mode in the back, because I want all of you, I think this is an important panel to have a call to action. And so, Dr. Jackson, maybe what's your call to action for everyone when we're talking about food? Is medicine food as medicine? What do you want people to take away from this discussion, just sort of ultimately?
Move away from the different stigmas and attitudes against botanical medicine and food as physical medicine, and just know that you can pair that with traditional, what we consider traditional, which is not pharmaceutical medicine.
Right. Love it. Thank you. Karuna.
So I would just encourage all of us to have a sense of optimism about the future of our food system, because we actually have a lot more power than we give ourselves credit for sometimes. So every one of you in the audience here and everyone listening to us, you make a decision 3 to 5 times a day, depending on how many times you eat, and you can make a different choice, and you're empowered to make that choice. And when you do that, I think the entire ecosystem does respond. So it takes effort, but I think whether you're going to do it once a day or once a week or once a month or whatever it might be, when you make that choice, it really speaks volumes. So I think just reminding everyone to be optimistic, because we really believe that that's what's going to change the system.
Thank you.
And I would say go to the Eating Well piece, read about the African Heritage Diet as Medicine, scroll down to the call to action section. You'll fill out the Black Food Census, learn more about what it means really to be a food citizen, and also go to foodbillofrights.org that launched a week ago to understand this conversation is about our right to food as our medicine, and to understand how it's a part of democracy for all of us to have a seat at the table. And follow us at iamwanda.org across LinkedIn, Twitter. Nope, not Twitter. We're not promoting that. And Instagram and Facebook.
Thank you so much. Tamara.
So I would tell people to be additive. It's not all or nothing. And so all of us are working in different spaces around food, and food as medicine, whatever that's, be that in our own kitchens or if you're a leader at an organization, recognize that you have qualities and people who are there and power that's within your space, and then add on from there. I think sometimes we were talking about food is joy, which I love that conversation. Sometimes I know a friend of mine gave me a shirt that said food police, which is a joke, right? People that see a dietitian coming, we actually are the best people to eat with, I would say. We're the most fun because everybody has a lot of knowledge with them already. The communities that you work with do as well.
Absolutely.
Add on from there is what I would suggest that people do, and do it with positivity.
Love it. Stephen, you get the last word.
She took mine. So it's taking the shame out of food. It's all foods fit. It's meeting people where they are in their life, in this moment, and it's just incorporating these things, so simple things. And I know Danny's probably mad at me because I didn't say it earlier, but it's including frozen options.
Oh, I love
and
frozen
low sodium, low sugar canned options. There's a huge variety of food to meet all of us where we are. So take the shame out of eating. Eat on, people, eat on and enjoy.
Yay. Thanks to this group of panelists. Give them a bigger round of applause, please. Bigger.